Well, thank you very much for joining us, Secretary Mark Inge with the Department of Corrections. Appreciate you taking some time out of what has got to be a very busy schedule in light of everything going on. I would like first off to just ask, how are you and your family doing? Your wife, is everybody kind of doing okay?
Also, thank you for asking. Family's doing very well. Of course, I'm here in Tallahassee and my wife's down in Walton County. So most weekends we've been able to see each other. Didn't do it the last weekend or likely not this weekend, but they're doing well, and the two puppies are doing well
Good.
As well.
Good. Well, I'd like to start off by talking about kind of the general nature of the system and where it's at. We currently have about 92,000, I believe, folks incarcerated across the state. And obviously, social distancing is a much bigger challenge in that environment, both for the folks who are incarcerated as well as the folks working in the facilities. Can you walk us through some of the challenges that you're seeing, and what are the specific policies that you're able to implement to kind of minimize any risks of kind of the spread?
Okay. Maybe the best way to walk it through, because it's more practices over policies, is kind of take it in time horizons. Prior to the first known COVID case here in Florida, we were in the flu season. So in prison environments, every year we're practicing our pandemic plan. And every year we're practicing those actions in our pandemic plan and those guidelines from CDC to address each annual event of the flu. And so we were in that mode already in, starting in December, but definitely January and February. So if the first cases in Florida, at least known, was the first week of March. And the governor started, of course, with the public health, and then did the state of emergency. In that period was really the first time we did something significantly different. And that was a decision to suspend visitation. I believe we're the second corrections agency in the nation to have suspended for the entire system based on what we were seeing in the first week of March. So the last visitation we had was that weekend, the 7th and 8th of March. The actual suspension announcement happened the following week prior to the next weekend. The reason we made that decision is taking advantage of our inherent social distancing from community spread potential, because then it was potential community spread. We have to always, it's hard to believe that we've really only been in this for about 6 weeks. But at that time, there's a potential of community spread. We didn't have evidence of community spread yet. So, there's three, we have, frankly, multiple fence lines that separate our, the inmate population that we're trying to protect from community spread on the outside. So what we have to do then is, how do we control those people that are from the outside to the inside? First group is family members, of course, and so we suspended visitation. And I will tell you, Sal, almost universally, family members have been appreciative of us taking that step and how early we took that step. And so the second decision was then on volunteers. I mean, we have over 8,000 amazing volunteers in the Florida Department of Corrections. And, they serve as mentors and instructors and lead faith-based groups and, different groups for betterment. But yes, we made the decision of that group, especially when a lot of our volunteers are from the retiree community, an at-risk group of individuals.
Yeah.
So that decision we made very early. So we were in this position then by the second week of March that in following CDC guidelines in the entrance procedures into the facility, asking, have you been on a cruise for 14 days? Have you traveled internationally? It's kind of a different set of questions early than what it switched to or what we're doing now. Have you had a temperature? If we got any yeses, the staff member went into timeout. Now, since the start of this, I've had over 2,500 staff due to circumstance, meaning I went on a cruise, or Joey down the street, I think, does have COVID, that we've said, all right, go to timeout. Think of that, 2,500 of our staff, we have not risked them coming inside our facilities, because that's where our first real line of defense is, controlling the sally port and our staff coming in and out. And we've been exceptionally successful. It's hard to see that with, some of the, I understand news headlines, but, COVID in 54 prisons. It's actually not true. The virus has gotten inside 4 state-run prisons and 3 privately managed prisons. Now, we've had staff, federal, for our state employees. Yes, I've had staff contract COVID-19 from, that are assigned to about half of our major facilities. So just for ease of number, we have about 50 major prison complexes, 145 facilities, but just 50 major. Of those 50 major, 4 have inmates that have contracted COVID. Only 4. And that's important for family members to hear. Using the CDC guidelines, and we are so closely aligned with CDC guidelines, they actually updated their guidelines on the 23rd of March. We took that guidance, we matched it against what we are already doing based on pandemic plan, what we do every year. Mm-hmm. We're on target. And so so given that the 4, if the social distancing from community spread fails, and I'll use that harsh term, fails, and COVID gets inside a prison, the idea is, though, hopefully the one individual who is turned symptomatic, we medically isolate them. Mm-hmm. So we posted all this on our website. I know some would have liked us to post earlier some of these statistics, but at Martin CI, one individual, and to the point of when that individual was determined to have COVID, we have successfully medically isolated so that spread does not go on to other facilities. Okay. That's the desire. So of the 4 state facilities, if you can keep it at 1 or 2, that is success of doing our social distancing, our first social distancing practice inside a prison, and that is to medically isolate somebody who's symptomatic while we find out if they're positive. And if they are positive, then obviously in medical isolation. Then what we do to keep that number as a 1 or 2, either the risk being another inmate, or more likely the risk being a staff member that perhaps had worked the night before, went home, halfway through the day he calls in and says, I've got a fever, I'm going to go in and get myself checked. We use what's called a medical quarantine. And initially, the initial guidance was, 24 hours back, do contact tracing. Later, the guidance is 48 hours. I know there's a robust debate of when somebody is contagious or not, but we're following the CDC guidance or contact tracing 48 hours, so that if say they worked a dorm, well, we place that dorm on security quarantine and immediately start checking their temperature. We give them classes, done a lot of education, but help them understand what security quarantine is. We keep that dorm separate from others, check their temperature twice a day. For those who are older, especially, we'll do check also their blood oxygen level as part of our checks. And we're watching to see if anybody comes symptomatic while we wait for the test to come back. So we've had dorms, and again, if you flip up and down our website, all those places where you see COVID tests negative of inmates, well, while that test was pending, there was probably a dorm in security quarantine.
Gotcha.
And when once that person went negative, then they came out. So that's a very fluid number. Those that are in security quarantine, but it's a protective measure. It's socially distancing by cohort of who might have come in contact, and we're just making sure for 14 days. And then the last thing, the last way to try to control spread within a prison system is to reduce the amount of movement between facilities. Now, we've greatly reduced movement between facilities, and there's a whole variety of why you move inmates from one facility to another. The first thing we did is we went back to the sheriffs and the major city detention officers and said, hey, we need 14 days to retool our intake procedure to build the process given COVID. So we did a 14-day pause, and then last month we did an intake from the jails that included, the medical check, a quarantine definitely on our side. Many of the sheriffs were great and did a quarantine on their side as well. And we brought that whole group in, and successfully the whole group of close to 500 at our different reception centers were COVID-free, stayed COVID-free, and then they do onward movement now in our system. So what that 14 days was called security quarantine. Whenever we move somebody, or whenever we're moving somebody during this period, anybody who moves or has to go to outside for whatever reason, they have to go outside the facility and come back in, we're going to keep them separate from the other inmates. No expectation that they're positive, so that column on our website of security quarantine doesn't mean anything but that's a new person to the facility, but we track it because that's important in our procedures. So there is that aspect, but then we have to talk the reality. The reality is we have two facilities where we've had, double-digit positive COVID, and the private managed facility has one of the 7 private facilities. Then that is where we then truly have to manage by dorm and cohort between those who are COVID positive. So where are we this week? Okay, so earlier this week, I was at Tomoka. And so I went to the one dorm that had, at that period, I believe there were 46 men in that dorm who were COVID positive. So, the deputy secretary and I, we gowned up and went in and spent about 30 minutes with them, talking with them. I wanted to hear, what their concerns, what their fears were, where we, how could we make this a more palatable time while they were running the course. And of course, the fact that they're in the dorm means their symptoms were not at any level that would have required us to take them to a hospital for doing that. So, but in interacting with them, and the week before I was down at Center and had done the same thing down there, which is our 2 locations of our facilities. So it really is a case of bringing the men who are positive together so we can really focus our medical attention on them because they're the ones positive. Then those who are symptomatic, waiting their tests back, they're cohorted. And then, frankly, almost everybody, well, now everybody else at Tomoka is in a medical quarantine as we monitor them. And then we've brought nursing staff from other facilities in to focus our effort. And I'll tell you, Sal, God love our nurses. They are amazing to because when they go into a location with either medical isolation or with symptomatic or with known COVID, of course, it's a full suiting up going in, and they wear that for hours and hours. I have a sister who's a nurse and a niece who's a PA, so I already had a great appreciation for that profession, but I sure felt it with those visits as well.
It's such an extensive system and kind of a mechanism to kind of keep it where it's kind of held at bay. It honestly had not even realized the level of which you kind of have been able to kind of make progress in that front. I'd like to shift and start thinking about looking ahead. Has the pandemic evolved either your short-term or your long-term priorities? I mean, you've been very public about ways in which you'd like to improve the system in Florida. And, how do you now approach those things given the reality on the ground?
Great question. So short term, yeah, absolutely. Tyranny of the urgent is fighting this battle in the way I just described, which again, I would argue is we're fighting it very, very well.
Mm-hmm.
Long term, this has just reinforced what the observations I had from my first year here as secretary, that, with pretty much unvarnished clarity, I testified both before House subcommittees and Senate committees. It it was only fair to not pull any punches on the reality. I mean, think of this crisis. We started this crisis short 3,000 staff.
Mm-hmm.
I mentioned to you how another 2,500 went into timeout. Absolutely stress to the system. Now, on the other side of this is what an amazing display of courage and commitment of FTC staff, of the Centurion medical staff, of those various contract models and our private prison partners that have risen to this challenge, in essence starting the race already exhausted.
Sure.
And the figures I gave on staff attrition, the impact of 12-hour shifts over 7 years, those statistics that resulted in the governor's recommendations for budget, the legislator's response,
Mm-hmm.
the budget to address staff attrition, to address those tools necessary to address violence and addiction and idleness in our prisons, to address the impact of aging infrastructure. When we're done with this, this crisis event, one of the analyses that we will do and certainly share is an understanding of the greater challenge of controlling a pandemic in some of our older structures. Anybody can do a Google search of Sumter and see this old, kind of compound structure, way of organizing dorms.
Sure.
That facilitates, a contagious event, as opposed to more, modern structures that help you isolate, dorm by dorm, wing by wing, and the like.
Yeah.
So that aspect, and the fourth, of course, that I addressed was, curbing the rising costs of healthcare and different ways of doing that, the use of telemedicine and all that.
Mm-hmm.
But with that, again, I just have to do a quick step back, because I know there's criticisms out there of how we address medical care, meaning the management model and procurement model for that. But those are still real doctors and real nurses and real PAs that are going into those dorms and are just, I'm telling you, I saw it. I was amazed at the dedication of the healthcare providers sitting right next to the correctional officers that walked right into that same dorm to address this. But to kind of bring it back is this crisis just reinforces in my mind that what I hope has been a very clear message, that we have to address staff attrition, we have to address violence and addiction and idleness in our prisons, we have to address the cost of healthcare, and we have to address our aging infrastructure.
So you kind of alluded to it already, Secretary Inch, but prisons aren't just about those that are incarcerated. They affect families and loved ones as well. So throughout this process, how have you and your staff been trying to, minimize as much as possible the struggles, for families that are wanting to stay engaged with their loved ones right now?
Thank you, Logan, for asking that, because if you really want to know, that's why I'm here, is to communicate more to the family members of the incarcerated, so they can see a face and a voice behind the letters that I've sent them, addressing exactly that. The hardest decision, most of what I've described today in terms of the practices and the policies of controlling a pandemic in a prison environment is just good corrections. It's nothing that innovative, because we have had years of practice at it, and it's practices we share. I routinely communicate with other secretaries of corrections, as we work best practices. But the hardest decision absolutely was suspending visitation, and then volunteerism, because the volunteers really are mentors for our men and women who are incarcerated. And so I was pleased. What is new to our system in the last 2 years is the introduction of email and video, grams of video, sharing video. Frankly, we're still figuring that out, but it's good that we're doing so. It causes some interesting challenges to be discussed after a crisis. But so we were able to work with our providers to increase the availability of both time and the opportunity for free interaction. Not all of it, but certainly that. Now we never have given up the opportunity for mail, which has always been the traditional visitation and written mail. So in the letters that I did to the family members, and what I would really want to reinforce is this is such a critical time for communication between family members and their loved ones who are incarcerated. Both sides of that equation need that communication. We often talk about victims of crime, and we should. We often talk about victims, within our system, both staff and inmates. Often we don't talk about the forgotten victims of crime, and that's the families of the incarcerated. Mm-hmm. It is a real dynamic in talking about the totality when we look across our criminal justice system. And so the best I can do now is absolutely encouraging that communication, and even to families. I mean, we all have complex families, don't we? And some of the dynamics are even more complex when one of the members of your family are incarcerated, and sometimes there hasn't been communication for years. Well, this is a really good time to reestablish communication, and I would encourage the families of the incarcerated to take this time to reach out to their loved ones. We'll do everything we can to facilitate it. I know we have kiosks that break down. We get the teams out there to fix them as quickly as we can, but the U.S. Postal Service hasn't broken down, and the letters work. So they are not dependent on technology. So I would, I know we're getting kind of close in our time, but if that could be kind of my strongest conclusion comment, is an encouragement. In the same way, I am encouraging our inmates to reach out to their families for the sake of their families. I'm reaching out to the families for the sake of their incarcerated loved ones.
So for our viewers, just to close, that want to learn more, where would you direct them right now?
Right to our FDC website.
Great.
I know you guys have the technology to post that link. Almost any question you'd have, and in such greater depth than I even talked about here, of how we're responding to COVID-19, just look for that big banner that says COVID-19 and click on it. And you are right there. Every statistic, which I really am not directing people to the statistics, because those are statistics that we use to manage the system. I would drop down to the frequently asked questions. We've really taken those questions that we're getting the most of, and just find, for those watching, find the question you're looking for and read that first. And then if there's another question, I have amazing folks in our citizen services that can reach out and find answers as well. And the easiest way to get it to them is by sending the email to me at fdcsecretary@fdc.myflorida.com. But that is monitored by our citizen services, and they go out, and usually before I can even read the email, they have found the person that has that answer, and they get that
awesome
answer.
Well, Secretary Inch, I really cannot thank you enough for taking the time to speak with us. I know the message is incredibly critical right now, and so thank you for everything you're doing. We wish you and your family the best, all of your team. we're here if there's any other information that we can help you get out as well.
Well, thank you, Sal, because I'll tell you, the state of Florida deserves to be very proud of their men and women in the Florida Department of Corrections and those that support us and our private partners. But they also deserve to be proud of our incarcerated population, who have been exceptionally cooperative, with just a few minor exceptions that always exist, I'm sorry. But on balance, our incarcerated population, the men and women, have been very cooperative. And so
Right.
folks deserve to be proud of that too.
Right. Well, we'll check back in with you very soon. Thank you again.
Thank you very much. There is one thing I forgot to talk about, was how quickly we responded to the change of CDC guidance on the mask. I had that ready, and I was going to show, our issued masks, our entire population will be in masks, within 2 weeks of the CDC changing their guidance. Can you imagine an agency our size issuing to all staff and inmates a cloth face covering based on changed CDC guidance within 2 weeks? I meant to brag about it is remarkable that within 2 weeks.
Yeah, oh, absolutely. Absolutely.
Or an aircraft carrier enough to go from, now the reality is we had already met with Pride. We had already verified that we had the material, because we kind of sensed it was coming.
Right.
So when it changed, it was a matter of dropping,
That's nice. That's preparation. Very good.
Our sewing shops at our facilities to increase the throughput, and 92,000 inmates and 22 FDC staff later.
Wow.
We're there. We're not recording right now, are we? So what
No,
I
we're still recording.
We're still recording. We'll cut this out.
Yeah. This will be the one that on the day I retire. But